Hi, I'm Garvin. Welcome to our telehealth video series. In this video, I will give a brief overview of what you need to know about panic attacks. In particular, I will cover what is a panic attack, how do you treat it, and how you can more successfully live with panic attacks. So we start with what is a panic attack. A panic attack is a sudden episode of intense fear that develops for no apparent reason and that triggers severe physical reactions. Panic attacks can be very frightening. When panic attacks occur, you might think you're losing control, having a heart attack, or even dying. Panic attacks were once dismissed as nerves or stress, but they're now recognized as a real medical condition. Although panic attacks can significantly affect your quality of life, treatment is very effective. So the panic attack symptoms can make your heart pound and cause you to feel short of breath, dizzy, nauseated, and flushed. Because panic attack symptoms can resemble life-threatening conditions, it's important to seek out an accurate diagnosis and treatment. Panic attack symptoms typically include a sense of impending doom or death, a rapid heart rate, sweating, trembling, shortness of breath, hyperventilation, chills, hot flashes, nausea, abdominal cramping, chest pain, headache, dizziness, faintness and tightness in your throat and trouble swallowing. Panic attacks typically begin suddenly without warning. They can strike at almost any time, when you're driving the kids to school, out shopping, sound asleep, or in the middle of a business meeting. Panic attacks have many variations, but symptoms usually peak within 10 minutes and last for about a half an hour. You may feel fatigued and worn out after a panic attack subsides. One of the worst things about panic attacks is that the intense fear that you'll have another panic attack. If you had 4 or more panic attacks and have spent a month or more in constant fear of another attack, you may have a condition called panic disorder, a type of chronic anxiety disorder. With panic disorder, you may fear having a panic attack so much that you avoid situations where they may occur. You may even be unable to leave your home, which is agoraphobia, because no place feels safe. It's not known what causes panic attacks or panic disorder. Things that may play a role include genetics, stress, certain changes in the way parts of your brain function. And some research suggests that your body's natural fight or flight response to danger is involved in the panic attacks. But it's not known why a panic attack occurs when there's no obvious danger present. Factors that may increase the risk, so be a family history of panic attacks or panic disorder, a significant stress, the death of or serious illness of a loved one, big changes in your life, such as the addition of a baby, a history of childhood physical or sexual abuse. So next is, how do you treat panic attacks? Medications can help reduce symptoms associated with panic attacks, as well as depression, if that's an issue for you. Several types of medication have been shown to be effective in managing symptoms of panic attacks, including the selective serotonin reuptake inhibitors, or the SSRIs. Because these antidepressant medicines are generally safe and have a low risk of causing serious side effects, SSRIs are typically recommended as the first choice in medication option to treat panic attacks. Drugs in this class that have been approved for the treatment of panic disorder include Prozac, Seroxat and Lustril. Next is serotonin and norepinephrine reuptake inhibitors, or the SNRIs. These medicines are another class of antidepressants. The SNRI drugs, called Effexor, is approved for the treatment of panic disorder. And then the tricyclic antidepressants, or TCAs. While effective, these antidepressants pose a serious side effects risk, including heart and blood sugar problems. And next, benzodiazepines. These medicines are mild sedatives. They belong to a group of medicines called central nervous system, or the CNS depressants. Benzodiazepines may be habit-forming, so causing mental or physical dependence, especially when taken for a long time or in high doses. Next is the monoamine oxidase inhibitors, or the MAOIs. Because these antidepressants can cause life-threatening side effects and require strict dietary restrictions, they're not commonly prescribed. If one medication doesn't work well for you, the doctor may recommend switching to another or combining certain medications to boost their effectiveness. Keep in mind that it can take several weeks after first starting a medicine to notice an improvement in your symptoms. Another treatment option is psychotherapy. Psychotherapy, also called counselling or talk therapy, can help you understand panic attacks and panic disorder and how to cope with them. The main type of psychotherapy used to treat panic attacks and panic disorder is cognitive behaviour therapy. Cognitive behavioural therapy can help you change thinking patterns that trigger the fears of panic attacks. It can also help you change the way you react or behave to anxious or fearful situations. During therapy sessions, you learn to recognize things that trigger your panic attacks or make them worse, such as specific thoughts or situations. You also learn ways to cope with the anxiety and physical symptoms associated with panic attacks. And finally, how do you live with panic attacks? So medicines can help reduce symptoms associated with panic attacks. Again, several types of medicines have been shown to be effective in managing symptoms of panic attacks. And as we said, they include the SSRIs, so they would be Prozac, Lustral, and Seroxat. And the next group of medicines prescribed are the serotonin and norepinephrine reuptake inhibitors, or the SNRIs. And these would be Effexor, would be an example, or Venlafaxine, the generic name. And finally, the tricyclic antidepressants. While they are effective, these antidepressants pose a risk of serious side effects. And the benzodiazepines and the medicines are mild sedatives, and they belong to the CNS depressants. And the monoamine oxidase inhibitors, because these antidepressants can cause life-threatening side effects and require strict restrictions, dietary restrictions, they're not commonly prescribed. Finally, there are numerous products available at Lynch's Pharmacy in Douglas to assist you in managing panic attacks more effectively on a day-to-day basis. To start with, we have numerous products to get you started on an exercise program, such as an exercise ball, floor mats, weights, and various other items to get you up and running on a program we create together and is tailored specifically to you. We also have various supplements and products which you can purchase from us without prescription, such as Kava, Melissa Dreams, CAMS, the omega-3 fish oils, vitamin B, ginseng, plus we stock light boxes to promote relaxation, blood pressure monitors and blood sugar monitors, and body fat monitors. So that brings this video to an end. Customers of Lynch's Pharmacy can avail of a brand new offering at Telehealth Clinic. You can book a 30 minutes clinic with us, and we help to increase your understanding of your illness. During a telehealth clinic, together we create a cohesive management plan which enables you to take a more active role in managing panic attacks with confidence. We provide you with the tools you need to live a healthy life. Call into us at Lynch's Pharmacy in Douglas and Cork, or call 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.